I'm Shannon Waters, and I'm a Coast Salish person from Stamanis First Nation on Vancouver Island. I'm a family physician and also a public health physician who looks at the health of communities. I'm also a first-time mum. I'm 30 weeks pregnant and very excited about this time coming ahead. Tobacco is something sacred to many First Nations communities all across the country. But like many sacred things, it needs to be used in balance. When you smoke tobacco, especially when you're pregnant, it's not only harmful to yourself, it's harmful to the baby that you're carrying. Pregnancy is a gift from the Creator and also a time when you can look at the way you're running your life and make healthy choices for yourself and the future generations coming down the line.
We need healthy bodies for our future generations and our future child bearers. We always want a healthy nation. Every time we take something from Mother Earth, we offer tobacco. There's so many ways to use tobacco in a healthy, traditional way.
So this is our Indian tobacco, and it grows here in Chilliwack Lake on the mountain, and we use it for ceremonial purposes.
Tobacco is one of the 4 medicines we use in the smudge.
We use it for prayer, offering to the Creator and the 4 directions, and asking for strength for whatever we're going to accomplish that day.
There's so much to learn about tobacco and the traditional use of it.
We have to look at tobacco for our people as more of a gift than using it negatively and smoking 2 packs a day.
You're abusing tobacco when you smoke it for social purposes or because you have underlying issues that you haven't dealt with.
You are dealing with the beliefs that you have that smoking will do for you and the habits that you have accumulated over the years that accompany the nicotine addiction. And those are the harder things to change.
I realize, and I'm very empathetic to the fact that smoking is a very difficult addiction. It's as addictive as heroin. What I tell teens especially is you have no idea what your potential is to become an addicted person until you're doing something that you can be addicted to.
I got pregnant with my daughter Allie. Once that had happened, that when you became pregnant, that it wasn't your body anymore. It wasn't yours, it was your unborn child's. So I had quit smoking so that it would give her a chance to be healthy, to have a chance to have a healthy start in life. And that was my first, I guess, one of the first gifts that I had given to her.
I had to give my baby a healthy chance too, and I find now he's pretty healthy. He's got no problems to his health.
I'm a new mom. I just had an infant almost a year ago, and I didn't smoke when I was pregnant with him.
I've never had kids, but I think I'm just thinking about it now and knowing the choices I have today, like I wouldn't want to be a smoker.
The rewards of smoking weren't greater than my son. My son's probably, he is my biggest gift to my life.
A lot of girls suffer with not knowing if they're pregnant, and so they continue to do all these harmful things to their babies.
You see it on, on TV, how it affects a baby when you take a puff of a cigarette.
The good news is that yes, you can quit smoking.
The first step was quitting. And it was a hard choice, but to find out you're pregnant, you have no choice in order to have a healthy baby.
So smoking harms small vessels, and so the placenta is completely full of small vessels. And so smoking harms the small vessels that nurture your baby. The overall risk that your baby will die in the newborn period is increased overall from a normal mom who's not smoking by about 40%. So it's substantial. Well, the specific hazards to an infant whose mother smokes in pregnancy is that they are much more likely to end up needing special care that's directed to premature babies. They're much more likely to end up in our nursery where they have difficulties with feeding, with their blood sugars, more difficulty with their breathing.
A lot of the problems you can have is with asthma and different bronchial effects. And chest infections come pretty fast, same with ear infections.
In the first 2 months of life, the risk of sudden infant death syndrome is significantly higher in infants whose mothers smoke in pregnancy.
My children weren't all healthy. They have diseases, probably because I smoke.
Infants whose mothers smoke in pregnancy, we know that they have a significantly greater risk of having behavior problems in early childhood. They're more difficult children, more likely to have temper tantrums and other what we call externalizing behavior problems where they're combative and difficult to deal with. The incidence of prematurity is increased at least 20 to 30%. So the risk of a baby being born prematurely is increased substantially if a mother smokes.
I had a friend that was pregnant and she used to smoke 2 packs of smokes a day, and I heard all the things that she went through in a delivery room because I was right next door to her. And on a tray was the placenta and it was covered over. And I got up and I sneaked over and I looked and I was, oh, what a horrible thing to see. It looked like it was gray and then underneath it was like black and it was kind of like crater holes all over it. And so I was pretty happy I didn't smoke when I was pregnant.
I have a stepson, and he's been my stepson since he was 2 and he's 17 now. His mom smoked while she was pregnant with him.
Didn't seem right to find out you're pregnant and you're holding a cigarette.
For the first 2 months of his life, he was in an incubator. His life was at risk. The possibility of him dying was like at 90%. And his mom, who smoked while she was pregnant, left the hospital. I'm thinking she felt so hurt by what she had done and didn't realize the damage that she had done at all. She didn't realize, and I don't think she meant it.
The effects of secondhand smoke, pregnant or not, anyone is affected by it.
Children who are exposed to secondhand smoke have a much higher incidence of respiratory problems, much higher incidence of asthma, and as I mentioned, the SIDS issue is of course significant with secondhand smoke. So yes, secondhand smoke is definitely harmful to children.
I smoke a pack and a half a day. I have 2 kids. My one daughter suffers from asthma. It's been a real hard thing for our family to deal with. Medical bills. We almost lost my oldest daughter 3 or 4 times because of asthma.
I tolerate secondhand smoke.
I smoked in the house. I smoked in the vehicle.
For the father to be smoking before, during, and after the pregnancy, they're also contaminating this little child.
I was always around the smoke. There wasn't a room that I could go to that was free for me to breathe.
I remember my grandma and my aunt sitting around playing cards and smoking. So it smelled like smoke when I was younger. But and my mom was a closet smoker.
My father still smokes, and I'll go into his house and it feels like, my mother has a perfect word for it, I get assaulted by it, just by the scent. It assaults me as soon as I smell it.
We smoke around them, and I know it's not very good because of all the chemicals. My boyfriend's youngest, he has a lot of problems with his health. He's sick all the time, has earaches, and it's probably because of us, because, we think it's all right to smoke downstairs, but it's always going up in the vents anyway, right?
I never smoked in the house. I would go outside, and I came back in, and my grandson said to me, "Grandma, why do you do that?" I said, "Do what?" And he says, "What you just did." I said, "I went out and had a cigarette." And he says, "Why do you do that?" He says, "Don't you know it's X'd? The X means poison." He says, "You're putting poison into your body, Grandma."
What you do now, you're creating a path for your kids.
Elders talk about how when you're pregnant and how you carry yourself and how you hold yourself is exactly how your child is going to be for the rest of their life.
Role modeling is the best way to teach others.
When I became pregnant with my son, I really took that into consideration, And I used to smoke once in a while before I was pregnant with him.
I want a healthy lifestyle, and if I had children, I'd want them to be healthy.
How you are is how your kids will be. So if you're a smoker, so are your kids.
I remember as a little boy, 4 or 5 years old, my mom would be smoking in the house.
They talk about their parents smoking, and I tell them, well, it was my grandson who got me to quit. And I think you can do the same for your family, is just remind them, look at all the poisons that go into the tobacco, how it affects you.
My dad was a smoker. He smoked his entire life. Before he was 16. So it was decades and decades of smoking. And it wasn't until my son was able to talk and ask him to quit that he was able to quit. So really, he saved my dad's life.
If you added up all the time that you need to just have a cigarette, that's a lot of times that you could be spending with your children.
I'm aware of the Quit Now program. It's a telephone and online-based program.
Quitnow.ca is an online 24/7 program for people who want to quit smoking from the comfort of your keyboard, wherever that happens to be. It's free to British Columbians. If you're a teenager who smokes and you decide to quit, go online to quitforlife.com, where you will fill out a personalized profile, and each week you will be asked to complete 4 or 5 activities online which will help you learn about why you smoke, how to quit, and how to stay quit once you get there. Quit Now by phone, free to British Columbians, available 24/7.
I know someone who did access that service, and it was helpful as you move through the program. Having that accountability from someone else, someone that's calling to support you, offering you some print materials.
If you've decided to quit and you have a craving, then you can call them and they'll talk to you about it.
The number is 1-877-455-2233.
I hate to see that unborn child harmed, and to have you harming a child before it's even born, I really suggest that's not a good part of being a parent.
My daughter, who's 6 years old now, and I smoked when I was pregnant with her. When she was 3 months old, she went into the hospital with RSV, which is a common cold, but it almost took her life. And I didn't really tell anyone that I smoked at that time, and so right now she has asthma. And I feel really guilty about that. My one focus is I need to prepare for the future generation. That is our job as mothers. That is our job as fathers. That is our job as cousins, aunts, uncles, nieces, grandmothers, grandparents. How are we going to prepare for the future generation so that they have equal opportunity to be who they want to be? And unfortunately, tobacco, it really puts a challenge to those precious children to be who they really are meant to be.